Do you ever wonder why you cannot get a partner pregnant, even though you feel healthy otherwise? That frustration can be a sign of Sertoli cell-only syndrome, SCOS. In simple words, SCOS is a condition where the tiny factories in the testicles that normally make sperm, called seminiferous tubules, contain only Sertoli cells and no sperm-producing germ cells. Imagine a bakery that has only the chef's Sertoli cells, but no baker's germ cells. The bakery looks normal, but no bread, sperm comes out. This condition leads to very low or absent sperm in the semen, which is why many men discover it when they try to start a family. What causes the no-baker situation? Most often SCOS appears without a clear reason. Doctors call this idiopathic. However, some known triggers include genetic changes, such as deletions on the Y chromosome or mutations in genes that control sperm development, past infections like mumps that damage the testicular tissue, exposure to high heat, radiation, certain chemotherapy drugs, or toxins that hurt the germ cells, hormonal imbalances where the body does not signal the germ cells to grow. Think of it like a garden. If the soil genes is poor or a frost infection heat hits, the seed's germ cells may never sprout. How would SCOS feel in everyday life? The biggest clue is infertility. Couples may try for months or years without success. Other subtle hints include a normal-looking testicle that feels slightly smaller than usual, low testosterone symptoms in some men, like reduced muscle mass, lower energy, or mild mood changes, though many have normal hormone levels. No visible sperm in a routine semen analysis, often called azoospermia. If you ever thought I am healthy but cannot father a child, why? That question points toward SCOS as a possible answer. Doctors use a step-by-step detective approach. Semen analysis, first test shows little or no sperm. Blood hormone panel checks FSH, LH, and testosterone to see if the pituitary gland is sending the right signals. Genetic testing looks for Y chromosome microdeletions or other DNA changes. Testicular ultrasound visualizes the testicle's structure. Testicular biopsy, the definitive test, a tiny tissue sample is examined under a microscope. If only Sertoli cells are seen, the diagnosis is confirmed. Treatment options focus on family planning rather than fixing the testicles. Assisted reproductive technology, a RT, if there are a few sperm spots, they can be retrieved and used for IVF, ICSI. Donor sperm, when no viable sperm can be found, couples may choose donor sperm. Hormone therapy is rarely helpful because the problem is the absence of germ cells, not hormone shortage. Think of it like trying to bake a cake without flour. Adding more sugar hormones won't help. You need the correct ingredient, sperm, or a substitute. Counseling and support groups are also important because the emotional impact of infertility can be significant. Can SCOS be prevented? Since many cases are idiopathic, there is no guaranteed way to stop it. However, some practical steps may lower the risk of testicular damage. Avoid long-term exposure to high heat. For example, hot tubs, tight underwear, keep the baking temperature normal. Protect yourself from infections by staying up to date on vaccinations, like MMR, and seeking prompt treatment for testicular infections. Limit exposure to known toxins, such as pesticides, heavy metals, and radiation. Use protective gear if you work with chemicals or radiation. Maintain a healthy lifestyle. Balanced diet, regular exercise, and avoiding smoking can support overall reproductive health. While these measures do not guarantee prevention, they help keep the testicular environment safe for germ cell development. Explanation: what's new in the world of SCOS research? Scientists are exploring several promising avenues. Stem cell therapy. Early lab studies are trying to coax stem cells into becoming sperm-producing cells, offering a potential future cure. Gene editing, CRISPR, Researchers are investigating how fixing specific Y chromosome deletions might restore germ cell production. Micro-RNA profiling, tiny molecules that regulate gene activity, are being studied to better understand why germ cells disappear, which could lead to targeted drugs. Improved biopsy techniques, new imaging-guided biopsies increase the chance of finding tiny pockets of sperm that were missed before, giving more men the option for ICSI. These advances are still largely experimental, but they give hope that one day SCOS might be treatable rather than just managed.